So let's talk about aptitude test. An aptitude test during an interview is a way of measuring your cognitive abilities. That's the way you think and process information. Those are your cognitive abilities. It's a way of measuring your behavior, how you behave in the work environment, and also to discover your personality traits, okay? To know how you think, the kind of person you are, and how you relate to other people at the workplace. That is all an aptitude test is about. And there are various kinds of aptitude tests depending on the field that you are trying to enter. But when it comes to nursing, what I know is that there are 3 ways that you are tested. That's verbal reasoning, your how you understand information, English, how you understand English, not just the English, but when something is put to you, how do you interpret it? That is verbal reasoning test. It's practically in as how you talk, your speaking skills, because in nursing you talk a lot. It's not just about jabbing people with injections and all of that. No, a lot of our work is talking. You have to be able to explain procedure to somebody. Oh, madam, I'm about to do this, and that, and this is what it will do for you. This is what it means. This is what you should expect. Or this medicine is this, we are giving it to you to take home. It is this is and that. You take it this time and this time and this time. You have to be able to communicate clearly to a client so that the client will help you do your work and you also help the client get better. So communication is key. So they look at your verbal reasoning, how you think when it comes to speech and communication. They look at numerical reasoning. Numerical reasoning is like maths. Maths, you use mathematics a lot in your nursing career. For example, if you're at the bedside and the doctor prescribes a medication, but the strength the pharmacy supplied might be higher, the strength might be higher or lower than the dosage that you're supposed to give. So, you should be able to calculate that the right dosage or the right reconstitution to give that client. We deal with data. You have to be able to interpret figures and know what language that figure is speaking, especially in public health. You do a lot of reporting, you do a lot of data collection, and you have to be able to interpret that data, and that data will help you work. So mathematical skills is needed a lot in nursing. That is why core maths is one of the subjects that is required for you to be able to do nursing. And then the third one is situational judgment tests. Situational judgment tests are there to assess the kind of person you are, your personality traits, the way you relate to other people. You want to see if you can work well with other people, because teamwork, organization, flexibility, endurance are all very good personality traits to have when you're entering the nursing career. So that is what a situational judgment test does. And so with this one, they'll give you hypothetical work scenarios to see how you will answer these questions. An example is the ones I've seen around, like you see your colleague nurse acting unethically. What will you do if you see your colleague nurse stealing a patient's medicine or behaving the way she's not supposed to behave at the workplace? What will you do? Even though you're supposed to answer it truthfully, because somebody up the top of her head will be like, I said, with I would tell the managers that this is what my colleague is doing. You know, off the top of your head, honestly, that is what you would do. But you also have to consider the kind of skills and personality traits the panelists might be looking for. Because so we will be away to cadre, it means you are a very disruptive and divisive person. You don't like harmony at the workplace. You have to be a team player. It's instead of saying, oh, outright, I'll go and choke that person, report them to the authorities. You can go like, oh, I'll approach the person, maybe find out why she's doing that and discuss with her if she can change or desist from the things she's doing. If it persists, then I can call somebody else to also talk to the person. And if it gets out of hand, then management will have to be aware, because it's not right for you to be stealing patient medicine or behaving rudely towards patients in the hospital. So that way, you are a team player. You are also very, very much sensitive to other people and how the service is supposed to be. Okay? So that is the aptitude test I know. In my next video, I'll talk about the shape and form it will take in the nursing interview exams. The shape and form it will take. So for the exams, we'll look at the numerical and the verbal reasoning test. And then in another video, I'll talk about the situational judgment test and the form it will take, because it's in relation to other questions I want to deal with. My name is Selassie. I'm a registered nurse here in Ghana, and I wish you all the best in your nursing interview. Bye, guys.